Hello, I'm Dr. James Bogash, publisher of Modern Health Myths, as well as the author of Causes of High Blood Pressure, Natural Blood Pressure Remedies. And today we're going to talk about a particular class of medication that is still used heavily for blood pressure. This drug is also sometimes used to control heart rate, which is a totally different story. But for blood pressure, the beta blockers, so the ones that end in OL, so propranolol, um, metoprolol, but they end in the OLs is the easiest way to identify the beta blockers. And these are pretty commonly used in managing blood pressure. Now we'll use other classes first, but I still have patients coming in who are on this class of blood pressure, or on this class of drugs for blood pressure. And the idea would be that we're taking these blood pressure medications to protect ourselves from things like heart attacks and stroke. But sometimes doctors don't read the research and may not be aware that the drug they're giving to protect something may actually create the very thing we're trying to protect from, which is ironic but not uncommon. And so in this particular study, and this has been around for a while, so this isn't new information. This is probably well over a decade old at the time of this recording. And group of researchers looked at 95,000 patients. So this isn't a small study, this is huge. And they found that using the beta blocker drugs actually increased the risk of stroke by 15% and a 22% increased risk of diabetes, which will then be bad for your blood vessels and cause things like stroke. Which is crazy because we're taking these medications to prevent bad things from happening, and it turns out that they actually increase the things we're trying to protect from. Personally, I think that one of the ways this happens is beta blockers block what's called the beta adrenergic pathway. Think adrenaline, and it's similar to that. And so if we block adrenaline, we can't do things like burn fat as well, because it will it'll break down, it'll prevent the breakdown of fat, because if you're running for the saber-tooth tiger, it's not the time to break down fat. We're going to break down things like muscle to get sugar much faster into the bloodstream. And so it would make sense that if we're on a drug that produces things like fatigue and slows us down and prevents fat from burning, that we could have some problems down the line. So personally, I think that's probably why this happens with this class of drugs. But the fact that it does happen is no longer in it's no longer in doubt. I mean, this study's been around for a while. It's a huge study, and so these were definite risks associated with this class of medication. So to me, this means the same thing it always means, in that controlling blood pressure has to be done with lifestyle. If your blood pressure is higher than it's supposed to be, it's a mismatch between your genetics and the way you're living your lifestyle. So sure, it's just it's just genetics, that's just the way it is. That's not true. Otherwise, you would have had high blood pressure at 4 and 5 and 15 and 20 and not developed it over time with age. So genetics are not, they may be a factor, but they are not the reason. It's the way you're treating the genetics. And if your blood pressure is high, there's a clash between your lifestyle and your genetics, and you need to figure out what that is and fix it, because the medications are there's a good chance they're going to produce the things you are worried about and trying to protect from. As always, I'll post a link to this particular study in the comments section. Make sure you like this video, share it with somebody who you think needs this information, and subscribe to the channel.